this video, I'm going to give you a manual therapy tool that I call neurofascial release circles. I'm pulling this together from a couple of different sources, and I really actually have stayed away from giving you, the sort of normal physical therapy tools that we use for chronic pain, stretching and foam rolling. And yes, I did talk about diaphragmatic breathing, but really more from the polyvagal perspective and toning that ventral vagus. After decades of doing manual therapy, and has been my true passion for so long, and working on releasing trigger points, I have been surprised that this tool has worked so well with releasing trigger points and fascial and muscle tension, as I have found it too with many different people. And many times I've thought, ooh, I actually was very proud of the fact that I feel like I have a good touch when it comes to working with people and releasing muscles. My fingers just sort of automatically go to those active trigger points and really often do a very nice job of helping those to release. But, I often have to get in there. And although I do it with a sense of respect and listening to the tissues, this technique is incredibly gentle and very different. So I have put a video in the comment area underneath this. It's a YouTube video called Strolling Under the Skin, and it gives you a sense of the area of the body that I want you to focus on. But I really got this technique from a book called Accessing the Healing Power of the Vagus Nerve by Stanley Rosenberg, who's a massage therapist in England. And he got really involved in a lot of the work I do, visceral manipulation, craniopsychotherapy, and he's has a really true respect and understanding of the polyvagal theory, has gotten to know Dr. Stephen Porges, and has, really began to understand the cranial nerves along with the vagus nerve, and, has been doing this work for a long time and has found some of these things to be really powerful. And so I've learned a lot from him and some courses I've taken on the vagus nerve. But I'm going to show you on my arm. Now, this is a technique that I've taught patients, but let's just pretend, realize that if you have a trigger point or an area of tension or a tender point in your pelvic floor or in your glutes or in your hip rotators, it's the same type of tissue that is in your arm. So I'm just going to show you here just for the sake of the video. But this is a very gentle technique. It's so gentle that I'm constantly trying to let up my tension. Okay. When you are working on yourself, or maybe you can teach this to your partner if that's possible, the less tension I have in the whole arm that I'm working on with, right? So I'm right-handed, I'm going to show you my left arm, but ideally my left shoulder, my left arm, my left hands, my left fingers are totally relaxed. So having that intention can be particularly helpful. And then what you want to do is find the area of pain, tension, your trigger point, and then you can go ahead and sink down to find it, particularly if you're in your, a muscle belly. Maybe it's actually better that I show you on my arm. Let's say I'm palpating it, and right in there is a little tight. You might even see me kind of rubbing over that. Now I'm coming back to the surface of the skin here. Okay, so all you do is do little gentle circles. So you've palpated, you've sunk your fingers down, you've found that trigger point, that particular tender area, and you just let up. You haven't moved, okay? You just let up what that area is, and you do little tiny circles, okay? It's so light that you almost feel like you're off the skin. But if you find yourself sliding on the skin, that's your little note that it's too light, okay? So you actually have to be moving the skin, but it feels like you're only moving the skin. So there's that fine line between sliding over the skin and being too deep into the muscle belly. You actually don't want to be in the muscle belly. You want to be in that superficial fascia between the skin and between the muscle. So when you're looking at that video, Strolling Under the Skin, you'll see that fascia is like this 3D hydrated web. And it's like you're giving information from where that superficial fascia attaches, which covers your entire musculoskeletal system. And that fascia is this communication all around your muscles, all around your nerves, all around your arteries and veins. It covers your organs, everything. It's fascinating. It's all connected. So to me, I don't really understand the physiology of why this works. I just know that it works. But it's like if I give this little gentle circle that affects that superficial fascia of calmness and of relaxation, it just kind of melts away. And so I'll do, when I'm working on someone, I'll do say maybe 4 or 5 little circles, and then I'll take a break And then I do it again, 4 or 5 little circles. And I do that maybe 4 or 5 times, right? And again, I've never moved my hand, so I know that I'm not like cheating. Right? He used to be like, I'm not gonna move my hand so my patient knows that I'm suddenly not on a different spot because it'll feel so different after we release it. And then you just sink back down and you feel the difference. Sometimes you have to do that a few times, but I have found this technique to be very powerful. Now, if you're in a position where you're actually tensing that muscle as you're doing it, it's not gonna work because you're already giving that muscle information of tension. So it's gotta be relaxed. So, what position can you put yourself in? And certainly if you have a partner that can help you out, it can be really helpful, let them watch this video and practice. Particularly if you find that, you're so sensitive that you can't handle that deep trigger point pressure, it just exacerbates you. This is a beautiful technique to calm things down. And it can work on the pelvic floor. I've done this a lot with external pelvic floor releases. Sometimes in the really, really deep muscles, it's a little harder to get out and a little awkward depending on where you're at. But if you have to move your genitals away, lie on your side, prop yourself up on your elbow, however you can get there. And again, even just releasing the hamstrings, the glutes, or the piriformis can be really helpful. So my suggestion is to practice this, maybe if you can find, a tight spot on your neck, maybe you have some trigger points in your upper traps and you can practice here. That can be really helpful. My daughter loves getting massaged, and sometimes at night, she actually carries a lot of tension here as well. And she's like, Mommy, I love a massage. Will you massage me? And I did this technique once, and she was like, what do you, kind of annoyed with me because she wasn't feeling the massage. And we tend to like some of us like that, deep pressure. But I did that. I said, just, bear with me. Let me try this. And I did that before, she felt the tension, and I did this a handful of times. And then I felt afterwards, and she said, Mommy, your hands are magic. How did you make that go away? It was so cute. So I hope that this works magic on your tissues. And if you have any questions, then bring them to class.